Why are intrinsic risk factors important for youth injury prevention? Have you ever wondered why some young athletes seem to get injured more often than others? The answer lies in intrinsic risk factors. These are individual physical and biological traits that can influence an athlete's chance of getting hurt. Understanding these factors is key for coaches, parents, and young athletes to identify who might be at greater risk and what specific areas need attention to keep injuries at bay. Intrinsic risk factors can include many things. For instance, previous injury history is a big one. If an athlete has been injured before, they may be more likely to get hurt again. Anatomical alignment, like how a knee or foot is positioned, also plays a role. Muscle imbalances, flexibility levels, and muscle strength are other important factors. Some athletes may have ligament laxity, which means their ligaments are looser than average. Growth and developmental stage, body mass index, gender, and movement patterns are additional elements to consider. Some of these factors can be changed through targeted training. For example, if a young athlete has weak muscles, specific exercises can help strengthen them. Others, like genetic anatomy or past injuries, cannot be changed. Recognizing these intrinsic factors is essential because they affect how an athlete's body reacts to physical stress. Take a young athlete with poor muscle strength or imbalanced movement patterns. They may struggle to absorb repetitive forces during sports, which can increase their risk of injury. During adolescence, rapid growth can also temporarily reduce flexibility and coordination. If training does not take these changes into account, injuries are more likely to happen. From a practical standpoint, identifying modifiable intrinsic risk factors allows for tailored injury prevention programs. Coaches and parents can focus on strengthening weak muscle groups, improving flexibility, and correcting movement mechanics. For example, young female athletes who are at higher risk for knee injuries can benefit from exercises that strengthen their hip and core muscles to protect their knees. Intrinsic risk factors also help in deciding how much training load an athlete can handle and how much recovery time they need. Athletes with certain vulnerabilities may requiring adjusted workloads to prevent overuse injuries. Being aware of these factors supports a balanced approach to training that respects each athlete's unique physical development. In essence, intrinsic risk factors provide insight into individual vulnerabilities and strengths. By addressing these factors through education, screening, and customized training, we can create safer sports experiences. This not only supports healthy athlete development but also promotes long-term well-being. Understanding intrinsic risk factors is a step toward ensuring that young athletes can enjoy their sports while minimizing the risk of injury.